Okay, Lucy, so we've agreed that you're here for emergency contraception and we need to do that today.
Yeah.
Because you've had this condom break. How long have you been using the condoms for with your boyfriend?
Since we started, so about 2 months, 2.5 months, I think.
Okay, and this is the first break that you've had.
Yeah.
Well, that's really good, isn't it? You've obviously been doing something right.
Yeah.
And you mentioned that you've been thinking about contraception.
Yeah, only, I mean, my parents don't know. So I need something that they're not going to find. Obviously, if they find, like, condoms or something in my room, they're going to, well, especially my dad, it will be, I think it would upset them. I mean, my older sister, she had a baby at 17, nearly 18, and I'm 15. If they find out I'm having sex now, then it wouldn't be good. They'd be really unhappy.
Do you know that that's true, or is that just what you think?
I think so. The way they reacted with my sister, she doesn't live with us anymore. So
How does your mum get on, or how do your parents get on with her now?
well, I suppose, yeah, they get on okay. My dad still finds it really difficult, obviously, but I mean, he loves, you know, that child. So I don't know. I think it's a really awkward situation for them, and it's really difficult for them. But we don't really talk a lot about that kind of stuff.
Sounds like it's an awkward subject for
It's
you.
really
as well.
awkward. Yeah.
Okay. So would you? I mean, if you could tell your parents or tell your mum, or then what you're saying is that contraception would be much easier for you to manage, wouldn't it?
Yeah. I mean, maybe if they didn't know yet about it. I think maybe.
What do you mean?
Well, if they didn't know, obviously if they didn't know I was having sex, if I could have something that I could hide
Okay.
from them, I think that would be easy.
Have you thought about what method you might want?
Well, I was looking at leaflets about the pill.
Okay.
Yeah, I was looking at stuff like that, and I think I'd like to try that.
Okay, well what we'll do is we'll get you to see the doctor to get a prescription, and that's no problem.
Okay.
You've been very responsible coming in today.
Yeah, it's quite scary, but yeah.
And our job is to kind of judge whether you're, whether you've thought about it enough and whether you're responsible enough to actually be prescribed medication.
Okay.
But also for you to help you think about whether you could tell your mum. And I just feel that it sounds like it's something that you might be able to think about a little bit more.
I suppose I could. I mean, I'm staying with my sister this weekend, actually. So, I mean, I'm sure. I mean, maybe if I got her to talk to my mum about it.
And have you told your sister? Does she know that you're
She
having
knows.
sex?
She knows.
Do you think she'd be supportive about you using contraception then?
Yes, definitely. Yeah, I mean, I don't know. I suppose if I got her to talk to my mum, maybe.
That sounds like a great idea.
Yeah. Okay.
Do you feel that they're happy with you having a relationship with a boy that's the same age as you?
I think so. They're probably worried that he's not going to be responsible. Like, not responsible. He's not going to act responsibly. But I mean, I don't know. We made the decision together, so we've got this far. So, without any mistakes. Fingers crossed.
Yes, you've done really well. So we're going to agree then that you've got a bit of an action plan, haven't you? You're going to talk to your sister and
Yeah.
get some advice from her and maybe get her to help talk to your mum, which will make your contraception decisions easier.